Hi, everyone. Welcome to the CRM category segment. Today, I'm with Ramani. He's the CTO of Kencor Health. Ramani, thank you for taking the time to chat with me. I really appreciate it.
Thank you, Carl. So thanks for the opportunity. Really fun to kind of sit and talk about where we started out, where we are going from, and being actually recognized for the work that we do in that particular segment. So it's fun to be here.
Great. Well, and to kind of give the audience a little bit of context, we've looked at well over 160 startups that we consider a part of that CRM category, and it really kind of looks like patient engagement overall. And one of the companies that really stood out to us was Kencor Health, and we're excited about not only the solution that you're building, but the platform and the applications that you're applying it in. And so we're going to get into a little bit more of the product today, but before we even get into those questions, Ramani, you have a visual that you wanted to share so that the audience has a good baseline of what you guys are doing, and I think it would be great if you started with that.
Sure. So Kencor Health. So what we actually are doing in healthcare, in particular segment, it's essentially patient engagement. So that's essentially our single most focus. Kencor Health's focus is to be the player in patient engagement, whether it's a telehealth platforms, there's a clinical trials, there are various different segments that exist, but across the board, if you look at it, the key element, without patients effectively engaging with any one of these, there is not much of a care that you can provide. As a care provider, you would like to be able to deal with the patients, whether they are in the office, in the hospital, in the clinic, or at home, how effectively you can engage and get the information that you need from them to provide an effective care, right? So that's essentially where we focused on. We've built a platform that can engage with the patients that will help these guys to provide a personalized, engaged care. Our core product is called SAMI. SAMI is essentially a AI-enabled virtual assistant for the care team, and it's a virtual companion for the patients. So it kind of sits in the middle, bridge the gap between the patients and the care team to make the overall engagement with them very, very effective. And it could be, as I said, telehealth. Now COVID-19 kind of brought up the whole set of vertical that did not exist before, but everybody is kind of at home. How do we engage with them effectively? So remote patient monitoring, clinical trials, and all of these areas, the common element, common theme is patient engagement. And that's where we put this product together, the SAMI.
Well, I'm curious, Ramani, what's the backstory about why you guys started this company?
So that's a good question. So regarding a backstory. So my background before starting Kencor Health has been in telecom area, right? So I did about 3-4 startups. One of the ones that you might be familiar with is called Ribbit. That was what Twilio does today. Was it back in 2006 when we started. We sold that to British Telecom. Before that, Syndia, which is a first ever voice over IP platform that was built to bring voice over cable for Comcast and other cable companies. So we've been actually in the leading edge technology platform building business for quite some time. And with that knowledge coming in, at that time my son was actually going to go to college, and he's kind of a little bit asthmatic. So I used to take a lot of interest in the way he's being cared for during that period of time. And I got worried, when he leaves home and goes to college, how can I be in the middle of this care? How can I get engaged in the overall care that he gets and be on top of it? And at least for my own satisfaction that he's getting the right care. Started working with a pediatrician that we know for quite some time. And that's what got me interested in, okay, a lot of things are broken here, from the doctor office to the hospital, to the clinics, all the way through, the one receiving care versus the one providing care. Everything is broken. Still, they're using fax machines and good old voicemails and whatnot, right? So with my kind of background, I said, that's where I need to start. That's something is broken. I know how to fix it, right? Kind of jumping in. At the same time, I found my, a partner friend. I know him for quite some time, Muthu, and he actually is part of the group at Kaiser that first rolled out Epic. First EHR rollout for Epic was at Kaiser back in the day. So he was part of that team, core team that kind of put that together. So he has a lot of the provider side of the experience, and he was actually looking to kind of, he was putting together a startup more on the patient monitoring, patient engagement area as well, with some of the devices to kind of monitor the patient's health and transmit the data. So we kind of joined forces together at that point in time to say, okay, effectively we put the platform together, tried it in certain verticals, say this has much bigger play. Let's take it to the next level. And that's the growth of Kencor Health.
Interesting. And the platform itself, it's unique in the sense that, and you just showed us the different verticals and the categories in which you can apply patient engagement. And from my understanding, your platform is able to create very personalized plans. It allows the users to automatically collect patient data from a variety of different ways, engage with patients in a number of different ways at any time. And I'm just curious, how do you start by how does your platform allow users to create personalized plans, especially at scale? Like, this feels like it would be a really difficult problem.
Right. So, to be precise, we don't create the plan. The plan actually gets created by the provider, right? They are the one who knows what the patient's condition is, what he needs, right? So the origin of the care starts from, say, for example, we go to a clinic or a hospital. We've actually have them convinced to use our platform for their care, right? So it's a good way to explain is the story of how we got our first customer. And so essentially it is a congestive heart failure clinic adjacent to a hospital. So they were having a lot of the hospital readmissions happening in terms of CHF patients. So they actually put together a outpatient clinic attached to the hospital with the cardiologist, monitoring them effectively to make sure their conditions are at optimal, that they can stay home and can receive care rather than into the ER and ED, over the weekends and the evenings, right? So that process was so mundane, manual and whatnot. So we actually went and said, hey, here is a platform. Okay, you actually, starting point is the basic patient information is in your EHR. We pull from there. That's the starting point, right? And the doctors already have a playbook of how they're treating these CHF patients. And we actually take that information. Say, for example, you had to measure your weight and blood pressure as well as pulse oximeter twice a day. And we had to actually pull that data for you, the patient. Here is the optimal baseline. If you actually are going up in your weight by 4 pounds within a week, or like within 24 hours you're going up by a pound, that means you have actually accumulation of liquid. So we need to actually jump in and react and do something right away. Otherwise, you're going to end up in hospital. But how do we effectively do that, right? So how do we tell you to do this every day and have the data, and then figure out who needs that intervention, who doesn't, right? That's a lot of manual labor that somebody needs to do. That's where we come into play. So we take all of that information, feed it into our system, and what it spits out on the other side is a conversational script. So our SAMI will take it and say, you know what, I'm going to converse with this patient. This patient is essentially phone savvy, so you can download an app and we can interact through the app. This patient is not. He actually has a caretaker or a family member who interacts only on the phone or on a computer. So depending on their interaction level and what they are capable of and what they need to do, so we actually send out the reminder and alerts to, and then we also give them a set of devices to do these, take these vitals. The way we did that was, scale is a commodity item. You can get an Amazon from $10 onwards, right? So but we work with certain vendors to say, okay, this scale has to be an optimal price that we can give it away for patients, and they actually can take their vitals every day on it, and without them having to go fiddle their phone or a computer with how do I connect with your Bluetooth, how do I do this with Wi-Fi. So automatically, we give them a box, they open a box, stand on and put the scale down on the ground, step on it, have the app open, boom, the data comes through, right? So the automatic synchronization of the devices with the phone, with the app, pulling the data in, transmitting it without having to have them do any manual work, right? That was key. How do you integrate all of those things, bring that data in, and compare against the baseline of the patient data
Mm.
and give the recommendations alerts to the doctor, who then effectively have a response how to intervene, which patient at what time, and deliver that in a timely manner, right? That loop we were able to kind of close it using our platform,
Mm.
right?
Yeah, and it
So it's
definitely makes
effectively
sense. Yeah.
it is more of a delivery engagement and
Mm.
delivery platform, if you will,
Yeah.
right? But in this process, what happens, what helps the care team is this particular patient responds well. And one of the things you don't have in EHR is the personal information about the patient. Is he an
Mm.
outgoing guy? Does he go out and eat every day? Is he actually eating a lot of pizzas? His lifestyle information, what they call, there's a term, SDOH, social determinants of health. That
Mm.
information is not stored in your EHR, right? That plays a
Mm.
critical role and play in how effectively the patient is managing their own health when they are at home,
Mm.
away from the clinic, right?
Mm.
So that actually is what we do to collect all that information. And you can't keep asking all that information. Some of them will what we call implicitly derived out of our interaction. Some of them actually is collected directly from the patient. And combination of that data will allow us to enhance our algorithm or AI engine to deliver better care again.
Mm.
It's feeded back into it, say, okay, this person actually, his weight keeps on increasing every day. He's
Mm.
actually, we found out he's eating out, every day. Might be
Mm.
that could be the factor. Maybe we need to have a lifestyle engagement change with this person for
Yeah.
him to be in a better with his CHM,
Gotcha.
right? So that's
Yeah.
what we actually enable the doctors to be able to deliver better care, personalized care through our platform.
Okay. And I'm curious, do you um, focus on a subset of healthcare conditions or chronic issues and diseases, or is your platform, it has pretty broad applications across the health spectrum?
We actually, as a startup, we're not a big conglomerate, so we can't be doing, we can't be doing everything, right? So yes,
Right.
we effectively focus on certain chronic conditions. So
Mm.
congestive heart failure is where we started, right?
Mm.
That's where effectively there was a need for a platform like this for the doctor, because 70% of the Medicare patients that are actually hitting the hospitals have one form or the other, either diabetes or congestive heart failure, hypertension. And pretty much the cardiologists see these effective chronic diseases being on the top of the list, due to
Mm.
which patients are coming back to the hospitals on a
Mm.
regular basis. And better care there, a remote patient monitoring, chronic care management will help them to alleviate some of these problems. And so our
Gotcha.
focus is all cardiology related. That's where we started. So we have congestive heart failure, hypertension, COPD, diabetes, all those modules covered. We are already working with a lot of clinics and hospitals with that. We're also now branching in, looking into oncology as well, where COVID brought up a need for the oncologist to engage with when the patients are going through the radiation therapy and whatnot,
Mm.
to have an effective engagement through our platform. So we're working with a couple of large cardiology groups to effectively build that care plan module to bring it to market.
I see. And the beauty of your platform is that how you, I guess you could scale, but keep the platform very custom to each individual patient, is that you empower the provider themselves to build personalized plans for each one of their patients.
Right. We follow something called 80/20 rule. So effectively, over a period of time, 80% of the plan is kind of templatized already in the system that we've
Mm.
gone through various iterations with the patients and the doctors. So now effectively that can be continued with the minimal modification, but 20% of the care, each doctors have a certain way of delivering the care for their patients. They
Mm.
would actually not only care personalizing to the patient side, also personalizing how these doctors engage with those patients, how they
Mm.
provide care. There's a little bit of a customization, what the rules and regulations they follow, right,
Mm.
over the standard procedures. So it's kind of that 20% of customization happens over a period of time to make the product, the platform feel like it is personalized for that patient and for that physician's office, which is using that.
I see. Um, I, I guess I'm curious to hear your thoughts and perspective on this, especially in working with in a variety of different use cases for patient engagement. What is actually the most effective way to keep patients engaged and continuing to take measurements, to continuing to stay engaged with their health?
Yeah. So
Curious.
yeah, first and foremost, when we start out with, right, and everybody first goal is, hey, everybody got a smartphone, let's put an app together, right? And it's easy to kind of give them an app and tell them to do, and they will kind of follow it. That's how we started as well. And we found,
Hmm.
yeah, well, if you're living in a Silicon Valley bubble, that might be true, but you step out of Silicon Valley, you don't even need to go too far. You just step out to Oregon or just Central California, you will find out, that is not the case. Right. So you need to have a different method of engagement in your smartphone app is not going to help you. Right.
Hmm.
So what we found out was you actually need, even if you actually use a smartphone or a regular phone for that matter, you have to have some way of making it sound natural. So two things you do, because you don't have time to bring the patient, keep him one place and teach him what you want him to do, right? Because you can't do that at scale. So effectively it needs to be like a conversation. So there are two things you don't need to teach the patient how to do. They know how to talk, they know how to text. Pretty much those two aspects of it, everybody knows, right? So we created this SAMI bot interface, right? But the SAMI bot, the moment I use the word bot, and I grudgingly kind of use that word, people think it is that AI bot that just automatically answer your question in a bit. That's not, it's much more than that. We created a patient conversational language, right? And that language, it can essentially communicate with the patient. So they don't need to, when they come in, they don't have to have a predisposed knowledge of which button and which menu and where to press to respond to what. The learning part, is not there. They can just come and jump right into it. So it makes it easier for them to, if they had to think, when you ask a question, think about, wait a minute, what did I do yesterday? I got to think this way, that way, which one I answer, you lost them. It has to be just, to them. Don't ask them to say it's a pain level from 1 to 10, right? Give them some pictorial, hey, your pain is kind of making you do like this or like this. Oh, this. So give them just two options. Gradually lead them to the way where you want the answer to. So guide them along, right? So how do you build that conversation in an automated fashion? That's what we do, right? When you do that, and that can be delivered over a phone or an email or with an SMS, with an app, and eventually on Amazon Alexa-like interface, once they become purely HIPAA compliant, that's the other key, right? The word HIPAA compliant, because you can't just deliver this over a standard existing tools out there, because a lot of personalization involved. So it needs to be secure and HIPAA compliant, right? So doing that, so breaking what the care team wants to collect or ask the patient, breaking that into modules, conversations, doing it at the right time. Again, maybe this patient is a morning patient, ask that interaction in the morning, make that phone call in the morning. Or this patient is an afternoon person, do that in the afternoon, right? That's effective. That is going to give you much better results of collecting the information that you need from the patient in a timely manner.
Okay. And you may have already answered this question in the last statement, but what do you think are the biggest barriers or issues when collecting information from patients or relying on patients to provide information about themselves so that they continue to follow a treatment plan or, continue to update on their status?
Yeah. So that's actually a good question. One of the learnings we actually had was we found, on the contrary, the patients are actually looking to engage. The patients are looking for it. So their experience today is, oh, I call the doctor office. I usually 99.9% I'll end up in a voicemail. I leave a message. And I'm at the mercy of doctor's office calling me back when they can. When they call, I might be having food. I might have stepped out. So I'm actually just sitting next to my phone, anxious, wanting to know, right? That's actually bothersome. If you provide them a mechanism tool to say, you know what, you are at your disposal. You actually have the freedom to engage with the care team at your means whenever it's convenient for you, and make it asynchronous. This interaction doesn't have to be synchronous, right? It can be asynchronous, so that you fire off things that you need or interact, through Sammy to the doctor, and the doctor's office can, oh, I'm busy, or somebody else can actually respond to that at the time that they have. The nurse doesn't have to wait for the end of the day or to go check at the voicemails to return the calls. Between the visits or between the and the break, she can actually look at it and respond right away. So information flow back and forth is much more effective and faster than the traditional interaction that happens today. And when you see that, it often what we find out is it's not the patients who are not willing to engage. The care teams sometimes run out of, because they're doing too many things. So they're running around. They don't have time to effectively manage that, right? It's not the patient. The wherever we see the breakdown happening, because the care team doesn't have enough cycles to respond in kind.
I see. Okay. And, I just so that the audience is well aware about this issue of patient engagement, can you tell us what providers, and maybe in the context of the first customer that you were working with, what were they doing prior to this? What was their method of trying to get patients to follow their treatment plans, or report of their update on their status? And how big of a jump is that now using your platform?
Yeah, good question. So good way to actually show you a piece of the product. Let me tell you what they were doing before, and I'll show you the product, so you can actually connect the dots and how this can be effective today, right? So prior to that, they make phone calls, right? That was the effective means of communication between, good old telephone systems. So they call, leave a message or whatnot, and if the patient happens to be there, or the patient needs an interpreter, they couldn't talk to at that point in time. So it might be one call, could be multiple calls to get that basic information. And when they want to, hey, what's your weight today? Did you take your weight? Oh, I wrote it down somewhere. So the conversation takes about an hour of a care team nurses for a day to effectively have conversation and collect information for just two people, right? The two patients to kind of interact with, it took about an hour, right? Whereas when we brought in this platform in, and if I can share the screen here. So this is one of the, this is essentially our remote patient monitoring platform for CHF, diabetes, hypertension, and one of the customers that we have. They use all the effective tools that we provide to be able to, chat with the patients, or a phone call, or, if we have to do a video call in a video visits, they can do that as well effectively. And kind of look at all the vitals. And we also provide devices. So automatically the vitals are coming in. You're looking at, okay, what is the weight? What is the blood pressure data? What is the pulse ox? So what are the interaction questions that we asked them? What did they respond with? All that information is already here. Before even they kind of pick up the phone doc, the information flows towards them, right? Sammy has engaged with the patient, collected all of this information, and help them to effectively deliver the care plan that is actually prescribed by the care team. Right? So that information interactions, how they're doing, the patient is doing, how the care team is doing, and how the time that was spent is automatically also calculated and tabulated, and a billing report is created, because now Medicare has streamlined this whole process, and they're reimbursing for this process, right? So effectively, there is a payment option. If in the end of the day, everything, there has to be somebody has to pay for the business, right? For a business to thrive. In this particular case, it's the payers, i.e. Medicare. So all the way from patient engaging with the care team taking care of them, and finally for Medicare for paying for that service, effectively done through this platform. Right?
Very interesting. So it's really, really unique how you've set up this, both the care plan, and also you've matched that with billing as well.
Right. It's a simple example to say is, so a patient is discharged from the hospital, he is diagnosed CHF, and he goes home. They fit him with the scale, blood pressure monitor, and pulse oximeter, send him home. He happens to have a mobile phone. In that particular case, our Kencor app is loaded onto that platform and sent home. So the patient goes home. And every day, he doesn't have to take notes or note it down. The SAMI is going to pop up and interact with him. Either it could be on a phone call, it could be on a chat,
Mm,
email to say, remind him to, hey, you got to go take your weight today. You got to take your blood pressure data. And that data is brought in and then
mm,
checked against his baseline. There could be further information automatically required for the doctor office. So, oh, okay, we see you're a little above the baseline. Doctor would like to have these information collected as well.
mm,
And that's all processed, and our algorithm kicks in to say, you know what, this patient we recommend to have intervention. So put them on what we call between green, red, and yellow zone. So green means they're doing well within the baseline. SAMI can
mm,
continue to care for them. Yellow is they're kind of hitting that borderline. Red means that requires intervention, right?
mm,
That decision that who is going to be in red or green, that algorithm was developed with the help of cardiologists. Okay, so we worked with a bunch of cardiologists to kind of define that
mm,
algorithm, and continue to fine tune that and refine it as well. And then the care team will actually can use all the communication tools available to collaborate among themselves
mm,
and with the patient, right? And
mm.
effectively provide the response care that they can actually stay at home and continue to feel better.
Interesting. Um, Ramani, I'm curious to get your thoughts on this because you're in a really unique spot where when you look at the healthcare ecosystem, you have the health management category, those who are building apps for managing a specific disease. Then you have the device category where they're building a device to monitor a specific issue or disease or general. Then you have the telemedicine, which is, you can connect directly with the doctor to discuss an issue that you might have at the moment. And sometimes in the management tools, there's providers have a more of a general care management tool. And they all seem like they're kind of converging and colliding with each other because they all have the overlap. And especially in your platform, yours is kind of a combination of all of them, which was also partially why I think it was harder to categorize you as a company. How do you look at yourself, or how do you look at this ecosystem and see all those different verticals and how they interact with one another, and the approach that you're taking? Why do you think that's the best approach out of these different types of categories?
So the one common theme, common element across all of those verticals you talked about is, end of the day, the one that is receiving it, who is all of these services is rendered for, i.e. the patient, right? Whether it's telemedicine or all the other ones you talked about. End of the day, the one that receiving the care, who needs to actually involved heavily, is the patient. If
Mm,
you take the patient out of that equation, you got all these fancy tools and technologies and solutions available with the physicians with that knowledge. They can't apply to it, right? Unless the
mm,
patient comes to, for example, a hospital, or the patient rings in a doctor's office, the doctor cannot provide the care. So that engagement of the patients on an ongoing basis, whether you have one-off relationship, a visit to the hospital, or an ongoing relationship with the doctor over a
mm,
longer period of time. As we all grow older, across 60, your best friend is, everybody says, who's your doctor, right? That's the question you ask for. You actually have a relationship with your physician and you continue to have it. And that's where we kind of focused on, right? And for that patient to be very effective
mm,
in dealing with your care team, and that's what we do. Okay, so we do that very effectively, and we kind of apply it to certain verticals. We cannot be in all the segments you mentioned, right? For example, we see telemedicine. We have video component, right? Today, in a post-COVID, video becomes another tool for engaging. Whether it
mm,
could be doctor to doctor, doctor to patient, it could be multiple areas, right? Just an effective another tool, right? If you end-to-end, if you do that as a virtual in a televisit, it's its own silo. But
mm,
a remote patient monitoring, or in a clinical trial, or even COVID care that people are. Video becomes another way to. I cannot be coming to the clinic all the time. My problem can be dealt at home, but video becomes only unnecessary. I need to kind of take a peek at the person, so come on the video and see it, right? It can be ad hoc, right?
mm,
It can be on demand. It doesn't have to be, everything has to be either in person or only in video.
mm.
combination can happen as well. So
Mm.
we effectively build this platform with all those tools in, so the care team can decide when to kind of use it. They don't have to use it all the time, right? Certain things can be just basic phone calls is good enough, or certain things, information coming from their vitals is good enough to kind of make a decision at this point in time. For certain
Mm.
areas, you need to kind of get involved and have a televisit call, right?
Mm.
So all the tools are available. You don't have to go to another department, call some other platform to do this. To engage with the patients, all the tools that you need is all in one place.
Mm.
That's what we built. And we focus in remote patient, chronic care management, remote patient monitoring. That's a sweet spot. That's where we started out with. That's where we kind of, focus mainly with all the different disease segments. All right.
Mm.
Whether it's in the regular chronic Medicare chronic care management, or in the clinical trial cases where now a lot of studies are being done post-COVID, how patients are dealing with post-COVID situations. A platform like this, you can see how effective it can be, right? Now there was also an opportunity. A lot of the schools and colleges now opening up post-COVID. They effectively wanted a screening platform that is that is not intrusive, that can actually can be used from home, provide the basic information for them to feel comfortable, as well as the schools and colleges to, or businesses even, to tell their business folks, say, hey, we are operating in compliance with COVID. We have taken all the measures required to stay healthy, do the regular screening. Nobody is actually having any symptoms. We are operating in the right way.
Mm.
That compliance, that info, that requires the people, for example, teachers on a daily basis taking the screening, having that information available, right? It's a HIPAA compliant data. It's not available for public. It is there. And there's an automated system like ours is holding that information. If health officials wants to have a data check to say, okay, there is a COVID outbreak here, did they do what they said they claimed to do? So there is actually data there now, right? There is a compliance information. This platform can actually do that. And in fact, we went live with a bunch of schools this week, which all got the waiver, for the elementary schools, which got the waiver program, and they actually are starting to open up.
Mm. Well, it's definitely interesting that not only are you working, directly with providers, but even outside the healthcare ecosystem, just like you said, with schools.
Yeah, and the reason they're engaged with this is a platform that actually handles the data in a secure manner, and that actually provides that comfort factor they're looking for, right? It's a compliant health data handling with the people.
Gotcha. So I'm curious, what is that implementation like to any type of provider that you work with? Is it something that you mentioned slightly before, that you do integrate with their EHR systems, pull data? Is this a standalone platform that is just another interface that they work with? How does a provider build this in or fit this with their current workflow?
It's in two different ways. One, to start with, this is a cloud-based platform, right? So we actually are in a cloud, HIPAA compliant secure cloud. And we integrate with all the EHRs. If you go to hospitals or clinics, you cannot actually work in vacuum. The information for a patient today exists in an EHR, right? That's where you need to start off from. As a physician, they remain in that. So we pull minimum information. We don't need the entire EHR dump for us to start with. We need, patient demographic info, what problems they have today. Start with that. And the doctor is basically, this patient is a CHF or hypertension patient. There's a template-based care plan that we have already built. We load it up. We start with that. And from that moment onwards, we are actually the one generating a lot of user data, all right? And that data will push it back into EHR. Now, EHR is actually growing by working in adjacent with our platform, right? So EHR has your clinical data. Whenever you went to doctor office and when you were seen in the hospital or doctor's office, they have that clinical data. What they do not have is a day-to-day user data, how the patient is actually managing his care at home. We are the one collecting that information and pushing, we process that data and push it back into EHR. So effectively, they can operate completely within the EHR if they choose to do so. But the folks, the front end folks who are providing the day-to-day care will use our platform, our interface, the one that you saw, to interact with the patient. And
Gotcha.
so physicians mostly stay on their EHRs, the care team, front end care team, the MAs and the nursing staff will use our platform to interact with the patients.
Okay. That makes sense. And it seems as though the platform itself it's very simple. And I'm assuming there's not that much, is there a lot of hand holding when onboarding that frontline staff that you talked about and engaging with patients?
So we actually are onboarding it. For example, if it is a COVID the COVID care product, that's 24 hours onboarding, right? So we literally sign the contract, next day they can start. If it is remote patient monitoring, whatever time they allow us to integrate with the EHR, right? So every department got to go through that process. So effectively, we can be up and running in less than 2 weeks.
Gotcha.
Right.
And it's I feel like having a simple implementation method is a big competitive advantage in these situations. It's just interesting because it feels as like a lot of healthcare software companies have much longer sales cycles than what you traditionally think of enterprise SaaS software. And it seems like working with providers can be really tough. And I'm curious how you've managed that.
Well, that's, we are no different from that problem, right? So we went through it and we're going through the same problem as well. So yeah, healthcare the sales cycle in healthcare is much, much longer. And effectively, if you take a hospital, for them to introduce new technology, something that they want to try it out, they have cycles only to probably introduce 2 or 3 different new solutions in a year. So you have to fit into, you probably need to be at the right time at the right place for you to get engaged with. So that definitely takes longer sales cycles. We work with a lot of the physicians. So we engaged with about 40 to 50 different physician specialties in cardiology, oncology, diabetes, and all the different areas. And the physicians are linked to these hospitals and clinics where they actually test it out, validate our product, and kind of take us to the front door to kind of engage with that. But like any other enterprise product, hospital sales cycles are much longer. Clinics and smaller entities are a little bit more faster to engage. Then the kind of now the COVID care with schools, that's a pure total the regular SaaS enterprise play is much faster because there's immediate need. You can get through that, so they use the product. So depending on their pain point, depending on engagement sales cycle, definitely goes much higher.
Gotcha. And it doesn't seem like you have issues with collaborating and integrating or working with EHR tools that providers already have. Yeah,
we don't. So if you're actually, one thing I understood coming from outside into healthcare, plus my partner has built and kind of lived in that HR space, we know that intimately. That is a necessary component. You cannot actually live away from it because traditionally that's where all the hospital and the healthcare information is residing today. So you have to work with them. There is no ifs and buts about it. You can't actually circumvent that. You don't want to go create another silo, right? So that's where the information is today. You use that data to get started, but don't ask for all that data. So what is the minimal data you need? So hence the providers are willing to share that info with you. Start out with it and then effectively show them the ROI. Hey, I'm bringing back, by you giving me this basic set of data, I'm coming back to you with more information that's going to enrich your platform for what you do. So there, once you show that, they are also interested in working with you too, because they want more information. They don't know how to get that happen. It's not going to happen right there and by locking itself. So they're willing to work with us.
Yeah. Okay. And for you, what does your business model look like in working in this patient engagement setting? And is it a subscription? Is it a engagement per engagement method? How does this structure?
It's a pure per patient per month subscription plan.
Gotcha.
That's what we do. So end of the day, business, you need to align what you do with who's going to pay for it. All right. And the healthcare is kind of a unique segment coming from outside from non-healthcare experience. Here, the person who's receiving the most benefits out of it, i.e. the patient, he doesn't pay for it. The care team, which is rendering that service and actually operating much more efficiently using our tool, doesn't pay for it. Somebody else see the, i.e. the payers, is a third entity which looks at how effectively these two, the patient and the care team is doing, how it is saving them the money and the cost overall in a healthcare cost, hence they're willing to pay for it, right? So you got to convince three different entities with your solution for you to get paid. That's kind of unique only in healthcare in this country, when compared to other enterprise business. So no wonder it takes much longer cycle to kind of prove anything and identify who's going to pay for it. That's why healthcare startups take quite a long time for them to be able to be in the revenue generation business, right? Once you identify it, it's a cash cow, right? So once you identify the need, you met all these three criteria, and somebody's willing to pay for it, right? Then it's matter of how much you can scale with your sales team, right? So it takes time, and you got to you need to be able to find out. And what we found out in that model is the subscription kind of payment model works, because Medicare, starting in 2019, came up with this remote patient monitoring reimbursement plan. And with our platform beautifully fitting into that model, we identified the source for the money. So we went with that, and we essentially render the service, and Medicare pay for it. And there's a rev share between the physician who's providing that care and us, for that, right? That model worked. And effectively, our business model is built around that model.
Interesting. And I'm curious then, when you are going to any of your customers, what is the deliverables that you tend to pitch, and what really resonates with your customer base?
So what we actually go and talk about is one key metrics, which is the patient engagement numbers, right? We say somewhere between 85 to 95% patient engagement over a longer period of time. So anybody can actually do it for a few days, few weeks, because when people are really in need for it, they do it. But doing it over and over for a longer period of time is probably the most difficult one, because boredom settles in. If you ask the same set of interactive questions or keep sending them phone calls and alerts every day, the patient is going to toss that phone or email away or kill the app and walk away, right? How do you effectively engage with someone over a longer period of time? That's the data we bring to table. Okay, your business, i.e. for your hospital, for example, for you to reduce your reimbursement rates where you are wanting to save money, you need to keep your patient engaged with your outpatient clinic over a longer period of time, so that unnecessary ED visits can be reduced. How do you do that? Here are the numbers for it, right? For the regular doctor office or clinics, which, for example, in congestive heart failure, where you actually have the patient engaged with you for a longer period of time, so the hospital visits are reduced, the patient's satisfaction index and patient loyalty is much higher, and end of the day, you're providing a better care than other facilities. So that actually is the only metric we kind of go focus on to kind of prove a point. Because with that, they see the numbers, the operational efficiency automatically goes up with their engagement, and the cost reduction happens automatically. So overall patient engagement and the patient loyalty goes up as well.
Okay. And how has the pandemic affected you guys?
Oh, big time. So when it actually happened in March, the premise for the way remote patient monitoring was set up to be is the first visit has to be in person for the doctor. You go and meet your primary care provider, who explains what the program is, put you on this program, give you the scales, blood pressure monitor, all the devices, send you home. Then you kind of start off, because the Medicare mandated that there has to be one face-to-face visit to start off with the program, and then it's all completely remote. All right. So as soon as the pandemic hits, everybody closed. Most of these primary care physicians' office were all closed. And the patients are not coming, and everybody stayed home. So that pretty much has stopped her. While it was actually helping us for the onboarded patients already who are in effect, but then started affecting our new prospects, right? So that kind of took a hit.
Mm.
So that's when we actually, quickly added our telehealth capability, video capability into the platform. That opened up quite a bit. So since they said we can do that over remote, so that actually helped us to push on our development pretty quick, right? Otherwise, we were planning to do that in a year from now. That actually a year became few weeks for us to bring some of the new technologies to adapt, kind of mold ourselves in a situation to be effective. And we also found an opportunity. We got a call from one of our customer, West Virginia University Medicine. So they wanted us to work with them on the COVID care they're going to do, right? Because they already use our platform for some of the patient engagement in the heart clinics over there. And they said, okay, why don't we put this together? So we worked with them initially to put together a COVID care product, right? So we used our SAMI to kind of deliver everyday COVID screening check.
Mm.
So it's pretty, even though it's a pretty standard template that from Apple to Google, everybody has CDC provided this. We took the base from CDC and created this bot interface, SAMI interface, to interact with the users on a daily basis. And but if you think about it, this is straightforward, nothing big about it. But then effectively you collect this information, give them the peaceful, okay, you're looking, okay, you're red, yellow, put them into same green, red, yellow bucket, and bring them to different segments where they effectively are connected to the right care partners, right?
Mm.
So uh, in this particular case, say for example, a school is using this product on a daily, in the morning, they have everybody kind of go through the screen. Okay, they're all green, they can come to the office, right? If it's an
Mm.
office building, say, hey, we screen them, then now you can come or you stay home, whatever the instruction may be. Or you're red, we send you here's the address to your nearest testing centers, go and take care. So effectively managing them all this remotely in an effective manner, right? So yeah, then you can look and say, hey, I can connect to the doctor, they can call you or video or chat with you remotely to kind of find out how you're doing,
Mm.
right? So effective management of the care becomes a lot more easier for them to kind of deal with,
Mm.
right? And then, we also covered all the bases. You get walk-ins, you have people at home and people visiting. How do you do a contactless screening across, whether it could be a hospital building, for example, one of the
Mm.
hospitals, they do the screening every day. They put two of their highly trained staff to do the screening, every day at the front. So they're kind of losing money on it. Those are highly trained nurses. They could be doing other effective work, but they were actually in the buildings doing screening,
Mm.
right? So we kind of brought this product in to say how we can automate that whole process using our existing product,
Mm.
right? That now has taken off, and we have quite a bit of schools and office buildings and hospitals engaged with us in using this platform for screening their employees as well as the visitors.
Mm. Yeah, it's definitely unique in a sense that it's great at one level to be able to collect information and be able to triage individuals for your COVID application, but then build that into a workflow where someone can actually manage their, in this case, their students.
Yeah, so one of the things we said, so you, for example, you got exposed, somebody said in that questionnaire saying, hey, I got exposed to somebody with COVID, that means you're automatically in a 14-day quarantine. We'll say, hey, today you're on day 1, day 2, day 4, okay, 14-day quarantine is done. Now if we
Mm-hmm.
check, you don't have any of these symptoms, now go and get the testings and get it tested. You're cleared. Now, we give you a QR code if you're all good. You can
Mm.
go into the building or business, you're back in business, right? So there's a path to moving forward, not that, oh shit, what I'm going to do, I got hit with COVID or I'm
Mm.
have COVID. So by managing this very effectively remotely using a platform like this, you can see a value in how a patient engagement platform can help not only in a chronic care management, in a pandemic situation, and there are going to be other future needs in research and other areas where you need to interact with large volume of people in a remote facility to provide care.
Wonderful. Well, I'm curious. what um, what do you see? What do you think the future really is for patient engagement, and what do you see that most people don't?
So COVID actually, I believe, gave a big push to use of technology in healthcare. All right. So uh, healthcare is one area still, it's pretty archaic. We still use fax machines, right? So if you go want your medicine to the pharmacy, the doctor has to fax or direct email through their system. Right. So uh, it is not due to they don't want to do it, but they don't have time to kind of adapt the change because they're busy providing the care. Any technology changes, they need to train people across the board and they had to actually get used to it. They need to understand how to do that. So they don't have time for it, right? Just time was the critical factor due to which they were not doing it, not because they don't want to do it, right? Then all of a sudden, they were forced to kind of speed up to say, okay, this is probably going to be the new way. Your normal way of doing business will come to a grinding halt. What do you do? Right? So you adapt like everybody else. So everybody, if you now telemedicine was only available in certain states, and they were kind of paid a half of 1/3 of what the normal doctor office visit was by insurance before. Post-COVID, all those things changed. Now, moving forward, what you it's going to happen, at least the way I see it is, non-critical health situations that can be dealt remotely over a video. People are going to say, come to doctor office when you have an absolute need for it. So that's much better than for you to rush to the doctor for the moment you sneeze, go rush and see your doctor, right? So technology has actually stepped in and is here to stay in some of those areas. So it is going to help us to provide much better care moving forward, which probably helps the doctors in the long run to spend more time with the real care patients they need to care for, rather than to see how many patients I can see today.
Interesting. I think that's a really big shift in the overall method of which how providers operate.
Yeah, and then also, if you think about it, you go to doctor office, they take your basic vitals there. So are they going to determine what care you need based on the vitals that they got just that day? That may not be the case. You might have actually gone, worked out, and basically gone in a better shape that day. But the moment you come back, you go, you start your lazy life back again, and everything, all your vitals drop. So and then you show up before your next visit. So there's no continuity. So with now technology is going to permeate in all walks of life, is probably going to have a data dump of all your key vitals all the time. And that is going to play a key role in how a care is going to be provided for you, right? COVID kind of exposed not everybody, even in a pandemic situation, it's not the same. This doesn't, a virus like corona does not understand, race, religion, age, demographic, right? It affects different people touches everybody, but touches in a different way. All right. So how do you understand? How do you correlate and understand and be prepared for the next one? Technology is the only one that can actually help us to be better prepared, deliver a better solution moving forward.
Fantastic. Well, this is great. I think Ramani, I think it was a really great overview of not only the product but the uniqueness about how you actually engage with patients and in a way that is scalable but personalized, and at the same time, how you have the ability to really reach out to patients in a meaningful way that's practical for providers, without having a lot of hand-holding through the process. And this is one of the things that I thought, overall, this is why we thought you were unique. This is why we wanted to highlight you part of this category, which is fantastic. And with that, before I go to the closing remarks, did you have anything else that you wanted to share, or anything that you would request at all from the audience?
Yeah. So as I said, technology plays a role in healthcare in a big way. Coming from outside of healthcare into healthcare, now that I've spent 4+ years in healthcare, I'm part of healthcare ecosystem now. I understand this segment much better, but you cannot actually make the change as an individual. I think as an ecosystem, that's why we can try to build an ecosystem. We got to build this together. New device manufacturers, need to keep in kind of what can I build in a certain standard way that it's applicable beyond what I do. It's not a vertical. No longer you can build in healthcare a vertical silo. You got to build as an ecosystem like the enterprise world out there, which will actually benefit everybody along the way. Whether the HR guys, were holding up their data for too long, now they're willing to open up. Everybody needs to open up a bit for us to work together so that we can be better prepared for situations like COVID never happen to have come again, actually.
Hmm.
So we need better collaboration and cooperation among the healthcare partners out there.
And that's where Kencor Health comes in.
Yeah, and our key is, as a platform, one of the key things, you cannot do it all by yourself. Even though we build the platform, we can be everywhere. That's not our intention. We would like to open this platform out for our partners to, build an ecosystem around us. Together, we can be much better than us as an individual trying to conquer this, big healthcare problem.
Hmm. Well, Ramani, this has been fantastic. And again, for the audience, this is, we featured you as what we think is one of the top companies within the CRM category. And so thank you so much for taking the time to share the details about your company and your vision and what you're doing. And this is awesome. I really appreciate it.
Thank you. Thank you for the opportunity, Carl.